Hi, I'm Dr. Lorelei Grunwaldt, and I would like to discuss the difference between saline and silicone implants with you. I get a lot of questions in my practice about the difference, and I thought this would be helpful to educate you. So there's two basic types of implants. There are saline implants and there are silicone implants. So what is a saline implant? A saline implant is a silicone shell. So you can see I have a saline implant here. This is the silicone shell, and inside is salt water. Now this implant isn't totally filled so that you can see that there's salt water inside it, and that's the shell. When it's inside your body, it would be completely filled with saline. You can see the nice round smooth shape that you achieve with this implant. I use a lot of these implants in my practice. They're excellent. What is a silicone implant? So a silicone implant is the same silicone shell as the saline implant, but it's filled with silicone. And so it's almost more solid state than the saline implant. And so you can see it also has a nice round smooth shape to it. So what is the sort of risk benefit profile of each implant type? So the saline implant, if it ruptures, the salt water comes out of it, it deflates, and your body absorbs the salt water. So this is a pretty natural way to go because you get salt water through an IV when you're dehydrated. You have to come back in and have the implant exchanged. Basically, it's a fairly quick operation where we just remove the shell and put a new implant in. That's also the downside to a saline implant. You know that it's ruptured when it's ruptured because it deflates. I actually think this is an upside to it because I would want to know if my implant were ruptured. Now, silicone, if it ruptures, basically everything stays inside your body. Typically, your body will form a capsule around the ruptured implant. The upside is that if it ruptures, you don't lose volume, but in my mind, that could also be the downside as well. You may not know it's ruptured because that volume stays in there. The best way to monitor for rupture with silicone implants is an MRI or an ultrasound every 5 years to check and make sure that the implant is in continuity, because if this capsule around it, the shell around it ruptures, the silicone inside can be up against your tissues. So that kind of goes over the risk benefit profile of each. I get asked about how they look. So both implants look great. They both have a nice round shape. They both look very natural. I would say that inside the body, you can get a great look from either implant. And really it's a question of patient preference, and really understanding how the different implants function. I also get asked a lot about how they feel. So they both feel natural inside the body. Once your breast tissue is covering them, whether your implant's under the muscle or if you have more breast tissue on top of the muscle, it is very hard to tell the difference. When I've placed these both patients, sometimes I can't tell without looking which type of implant it is. Outside the body, the silicone tends to feel more natural, though the saline tends to feel more like a water balloon. But inside the body, it's very hard to tell the difference. So I think that both these implants are great options, and it's just a question of patient preference and education. I also wanted to talk about a newer implant type that Mentor has on the market called Boost. This is a Boost implant versus their traditional implant. And I don't know if you can see in the video, but the Boost implant actually has a little bit more cohesiveness in the sense that it when you push on it, it's not quite as soft as the other implant. And so it gives you a little bit more of that upper pole fullness, a little more projection. I think it's a great option for someone looking for a natural rounded breast, but wants a little bit more of that upper pole fullness, but doesn't want to look unnatural. So this is Mentor's latest implant called Boost. So anyway, I hope this has been helpful to demystify the different types of implants. There are many different manufacturers of implants on the market. They're all great, and just ask your surgeon questions so that you can understand exactly what they're using and make sure that you understand the difference. Thanks.